hair, skin, and nails assessment on you. Is that okay?
That's fine.
Okay. So first I'm going to inspect, and I am inspecting your skin overall. And I note that, is it okay to call you Ms. Thomas?
Yes.
Okay. Ms. Thomas has evenly colored skin. Can I pull your mask on just a
Yes.
second? Can you pull your mask on?
Yes.
Okay, evenly covered skin with various size moles noted. I'm just going to look. Okay. I don't see any unusual discolorations, bruising, or lesions, and no vascularities. Vascularities would be highly visible, kind of prominent vessels. All right. Your skin looks intact to me, without any reddened or purpled areas. I don't see any discolorations. Like I said earlier, I'm going to test for blanching. So the blanching is when I apply pressure to your skin. If it turns white, and then as I remove the pressure from your arm, it comes back to the original color. And that's just testing blood flow. And that looks within normal limits. If I saw any lesions on you, I would do an assessment called the ABCDE assessment. So what I'm looking for there is asymmetry, borders around those lesions, the color, diameter, elevation. All of that would be an assessment of abnormal finding. I don't have any of that on you now. Is it okay if I assess your scalp and your hair? Okay, I'm gonna go ahead and put some gloves on for that. What how do you call your hair right now? What
So
do you call that?
this is natural lock. Lock, L-O-C, hair.
Okay, it's very pretty.
It's natural growth without combing,
Okay,
washing, conditioning, but not combing, twisting.
Okay.
Same by twisting.
okay, nice. Do you do that yourself?
Yes, I can, but I usually do.
Okay, so I'm gonna inspect your scalp and the hair. Okay, so it's clean. I'd say it's a little dry. Is that normal for you?
It's dry today.
Okay. Does that happen with the weather?
Happens with just laying down on different sheets and things like that, but I have to oil my scalp.
Okay. All right, well right now it appears to me to be clean, dry, with no lesions, no abnormalities. Okay, let me wash my hands and dispose of my gloves.
And I leave my shoes.
Oh, thank you. Okay, now I'd like to look at your nails. Can you hold your hands out for me? Oh, good, lovely.
That's short.
Yes, well they are nice. The nails are clean and nicely manicured. I'd say that there are a little bit of pigmented streaks in that nail bed, which is within normal findings. Do you have a little clubbing noted? Yes, you do. A little clubbing is noted on both hands. Okay, thank you. And it looks like the nail bed is intact to the nails. All right. So I've done your general inspection. I've checked your scalp and your hair and your nail beds. If it's okay, I'm going to go ahead and do some palpation of your skin. I'm going to raise your bed. I probably should have done that for my comfort level.
Yes.
Okay. So I'm going to assess the temperature of your skin and the moisture of your skin. Okay. I'm going to use the back of my hand to test the temperature. And the temperature feels warm to me, not unusual. And then I'm going to use the palm of my hand to test for moisture. And your skin is pretty dry. I don't feel any moist areas. And I note that your skin is even, with the exception of those moles we noted earlier. I don't see any calluses. Bend your elbows for me. No callus areas there. Do you mind if I look at your heels? Sometimes the knees and the heels, you have some calloused areas. Nope, no calluses noted. Thank you very much. While I'm down here, I'm going to just go ahead and check for edema. Okay, so edema is when I press into your feet, and if it comes back naturally, then there's no edema, and I don't see any edema. Okay, so after I do edema, I'm going to go ahead ahead and check for your skin mobility and skin turgor. The book may say to have them lie supine to do this, but you can also assess that sitting up the way she is. Are you comfortable like that? Would you like me to bring your bed up? Okay. So to assess for skin turgor and mobility, I would like to go ahead and lower this part of your gown, if that's okay with you. Okay. Okay, and at the clavicle area, I'm going to just pinch up a little bit for turgor. And it looks like that skin turgor and mobility are within normal limits. Your skin has immediate recoil. There's no tinting. Mobility refers to how easily your skin kind of bounces back, if you will. You have good skin elasticity, and the skin returned to original shape after I pitched it. So your skin turgor, it looks like you're well hydrated. So I'm going to palpate your nails next. And your nails are smooth and firm. Like we noted earlier, there's a little bit of clubbing, but the nail plates are firmly attached to the nail bed. I'm going to go ahead and assess your capillary refill on both extremities. And that capillary refill is less than 2 seconds. That indicates good peripheral perfusion. So this concludes the mini assessment of hair, skins, and nail. Thank you, Ms. Thomas, very much. I'm going to go ahead and lower your bed so we can get you.
Don't let me fall
I
off this
will
bed.
not. I will not. Would you like to lie back down? All right. Here's your call bell if you need me. You comfortable? Can I get you anything?
No, I'm good. Thank
All
you.
right.
You're an excellent nurse.
Well, thank you. You call me if you have any questions.